All right, hey everybody, it's Dr. Joel Eby and Dr. Jessica Shida from Mission Move, and today we're talking about pains in your butt, but one specific pain in your butt. Okay, so zoom in here. I got the anatomy model on the app here, and we're going to talk to you about a pain that occurs right here. This is your gluteus medius muscle that comes in to the greater trochanter, and there's something called gluteal tendinopathy. Gluteal. Yeah, I guess you can call it either one. And you'll get pain right there. There's another something that causes pain in the butt called piriformis syndrome. It's different. That's the piriformis right there. And then sciatica and some other ones. So you'll need to be able to differentiate between these. So we'll give you some of the symptoms that you'll feel when you have this. The main symptom is honestly pain right around the greater trochanter. So stand up here for a second, Jessica. So like if you feel like where the bony part is on the outside of your hip, right? And you can kind of feel that by doing what she's doing right there, going back and forth. It's kind of this spot right on that bony part. And then you'll probably feel it a little bit behind there too. Okay, so this is where you'll get glute tendinopathy. A lot of athletes feel this. I don't know, tennis players, runners, anything where you're using your legs a lot, basically. So any sport where there's some sort of running involved, even some lifters get it too. Mm-hmm. And so yeah, that's gluteal tendinopathy. Now there's definitely some things that you shouldn't do when you have this.
Mm-hmm. So when you think that you have this may be something that you're experiencing, some things that are a little counterintuitive that actually could be making the problems worse are actually stretching it and compressing it. So if you have some pain there, you might think like, oh, let me try to like get a stretch there.
Stretching fixes everything.
Yeah,
right?
I mean, of course,
everyone wants
thinks
to stretch
that.
it.
Yeah, but unfortunately in this case, it actually could be making the problem worse. So some common stretches that you don't want to do, Joel's going to show us here. Yep. So first one, just this classic figure 4 stretch. This is super common. People are always trying to get to that area and they'll do this to try to stretch it. But again, the stretching just pulls on that bone and on that tendon and makes it worse. Another one similar is the pigeon stretch. So that one you can do up on a bench or you can do it on the floor. Same idea.
Yeah, so, this is like on the floor, you'll see people doing this.
Yeah, it's kind of a yoga move type thing. That, and then the last thing that you definitely don't want to do is compress the area. So a lot of people will grab a foam roller like this, and then they'll just dig into that area by just putting all their weight through it and just rubbing as hard as they can, even though it probably doesn't feel good. They think it might help, but it actually doesn't. So.
And even sometimes people who sit cross-legged like this, like if you sit this way at work or something where you're crossing the midline of your leg, you might feel it with that even. Yeah. That could irritate it, right? So that could even be a test for you, like if you thought, well, maybe I'll sit with my leg out to the side if that makes it feel better. That's often another sign of people who have this glute tendinopathy is they'll feel it when the leg's on stretch like that. They don't realize you're actually stretching when you're doing this is what's occurring. So there's some of the things you don't want to do. Now, what should you do? How do we treat it?
Yeah, so I'm going to give you guys just 3 really basic starting exercises that I want you guys to start doing and see if you can get this thing moving in the right direction, okay? So the first one is actually just really an isometric hold of the glute, right? So the glute med does abduction, which is bringing the leg away from midline, so out to the side. So the first exercise that you're going to do is actually just an isometric hold of that position. So if you're just starting out, you can actually just do this with your hip down, laying down like this, and just lift. You can come all the way down so it's not so awkward, and just hold it. And you're going to want to hold that for probably about 30 seconds and do 3 rounds of that. And then if you're a little bit more advanced, you can actually come up into a full side plank and hold that leg up like that.
And you'll see here from this view, come over here, you'll see from this view, when she's doing this, it'll feel, you're doing it right if you'll feel like your leg is almost behind you, is what it'll feel like. So a lot of people when they first do this, they're like out in front. And you're actually working your hip flexor and not getting what you want. So you can see Jessica's actually in a nice straight line, but it will feel like the leg's behind you, okay? So that's really important when doing that.
Yes.
Sorry to make you hold that whole time.
That's right. I got some strong glutes.
That's right.
All right, so the second one is going to be a banded bridge. So we're going with that same theme of that abduction, so pushing the knees out, and then adding a little bit of hip extension to that as well. to kind of get the other big glute muscles on board with this too. So with a banded bridge, you can just use a little mini band like this, put it around your knees, put your feet about hip width apart, and then the whole time you want to put tension on that band and hold it there. So a lot of times when people do a bridge, as they come up, they'll let their knees come together. You don't want to do that. So you want to push against the band, squeeze your butt before you even go to start, and then squeeze your butt at the top and keep that nice push out on the band. And again, you can hold this, or you can go up and down or kind of do a combination. So maybe go up and down, hold it at the top for about 5 seconds, and then come back down. So that's the second one. Then the third one you want to do, again, is another abduction variation, and it's just going to be like a banded sidewalk. So this one's also commonly done incorrectly. You may see people in the gym kind of doing this sort of thing where they're just like stepping and then coming together. But to get really the most out of this exercise, you want to hold the tension on that band and keep it there the entire time. So you're going to push out those knees, get into a little mini like athletic position here, mini squat. Push the knees out, hold them there, and then just take tiny steps so that that distance of the knees never gets closer together. So it's kind of mini step out, mini step in. And just keep that tension. You can go 10 to 20 steps to the right, 10 to 20 steps to the left. In all of these, you should really feel in the sides of your butt and the back of your butt.
Yeah, and you should almost be with those first two, you should be doing those with very minimal pain before you would move to this one, I would say.
Yeah.
Right? Because those first two are isometrics where you're trying to get some activity of the muscle and some input to that tendon that's inflamed before you move to the one where there's a little bit more movement. But those are 3 great exercises to start with if you suspect you have gluteal tendinopathy. If you're not sure, because like I said in the beginning, there's a lot of different pains in the butt, reach out to us. We can help you differentiate based on asking you a few different questions. But if you do think you have this, give these exercises a start, and then obviously these are just the beginning. We progress into things that are a little bit harder depending on what type of athlete you are, making it more specific. But give these a try if you think you have gluteal tendinopathy, and thanks for watching.